continue this discussion of the whole you part 2. At this time, I would like to welcome Leonardo Roll to do the prayer before we get started officially. Leonardo Roll, one of our health leaders from the Exuma district. He will do the prayer for us.
Good afternoon, everyone, and welcome. I bring greetings from the Exuma district. Let us pray. Heavenly Father, we thank you, Lord, for the blessings of this day. We thank you for all the gifts you've bestowed upon us despite these challenging times, Lord. Lord, I want to pray, Lord, for each person on your panel this evening, Lord. I pray that you may give them wisdom and guidance, Lord, that they may speak the words that you may want your people to hear. Lord, we realize that we are in some serious times, Lord, and many persons are under pressure, whether physically, mentally, and also spiritually, Lord. So I pray that you may give them the words to say, and may the right people, Lord, who need to hear a word of encouragement or to how to cope with their situation, may tune in this evening, Lord, and may you help them to ask the right questions, and may your panelists, Lord, give the right answer. I pray, Lord, that you may be with Sister Lacroix and all those who are putting on this event, Lord. We thank you, Lord, for this and such a fitting time. We realize, Lord, that our human bodies are connected, Lord, in every way, and every physical, mental, and spiritual aspect need to be joined together to help us to be healthy as a whole person. So I pray this evening, Lord, that your panelists may be a bit of hope and inspiration to those in need. Bless everyone on this platform this evening. Be with all those who tuning in. I ask these things in no other name, but in Jesus Christ's name I pray. Amen.
Amen. Amen. Thank you so much, Brother Roll. Coming now with greetings is the leader of our organization, Pastor Kenny DeVoe, who currently serves as the president of the South Bahamas Conference of Seventh-day Adventists.
Thank you, Sister Nadlin. Good evening, everybody. Happy Sabbath. And so good to see all of us who are on this platform this afternoon. I want to, first of all, commend Sister Nadlin for having the idea of bringing us together to discuss the total person. As Christians, we should always be interested in the total man, physical, mental, and spiritual. As a matter of fact, that is what we are told in 3 John chapter 2. God wants us to prosper, to be in health, even as our soul prospers. And so, Sister Nathan, just for the fact that you're able to bring such a wonderful cadre of professionals together to assist us with all of our concerns, to help us as we navigate this difficult time of COVID-19. We want to thank you. We want to thank the Pastor Paul and the Assembled Church for being our host this evening. And we trust and pray that as we spend time together listening to the professionals, that they will give us ideas and suggestions and advice on how we ought to handle ourselves and to assist our brothers and sisters to navigate this very, very difficult time. We know that God has promised us that he will never leave us nor forsake us. And so we trust him even as we go through COVID-19, and we know that God will do the very best for us. So once again, thank you so much for the invitation to be here, and may God bless us all as we learn this evening from our professionals. Thank you so much.
Thank you so much. Thank you so much, Pastor DeVoe. Just before we introduce our cadre of panelists this afternoon, we will be favored with a special item of music by But for Grace, the group called But for Grace.
It was such
Amen. Wonderful. I know the peace speaker. Amen. Wonderful item of music. The format of our discussion will be in the form of a question answer. Question answer. Okay. So we're inviting persons on the platform to put questions in the chat relating to your physical, mental, or spiritual well-being, and we will direct those questions to our health professionals. Of course, we have persons who will be reading those questions because everybody's mic will be closed, and so we're only entertaining questions that come through the chat. We have 3 persons who will be reading the questions for us this evening. They are Mrs. Erica Marshall, Mrs. Patricia Clare, and Mrs. Dessa Bodie. And let me just mention to you that the 3 of these persons are health leaders in our local churches. Sister Bodie is from the Cat Island District, and Erica Marshall is from the North Andros District. Our panelists for this evening are Miss Shandira Smith. And when I call your name, please, can you just open your mic and tell our participants on the platform a little bit about yourself. So Miss Shandira Smith, who's a nutritionist, please go ahead. About 30 seconds to a minute.
Good afternoon, everyone, and happy Sabbath. Yes, so as Sister Nat mentioned, I am Shandira Smith. I'm a dietitian by profession, and I love food. I guess that's why I've been in the field. And I'm really passionate about health, and my desire is to see everyone live as healthily as possible until Christ comes. So we'll be ready to go with him, and that we all will actually obtain the best health that we possibly can.
Thank you so much, Ms. Smith. Dr. Joseph Evans, who is a urologist.
Good afternoon, everyone. It's a pleasure being with you. I am Joseph Evans, a urologist, a second-generation Seventh-day Adventist with membership in the Grantstown Seventh-day Adventist Church. I'm looking forward to answering your questions this afternoon.
Thank you, Dr. Evans. Dr. Sean Knowles, who is a physician in medical health.
Yes. Hi, good afternoon, everybody. Happy Sabbath. I am Sean Knowles. I'm currently a registrar at the St. Helens Rehabilitation Center, where I work on the addiction unit. I'm passionate about addiction science, especially that aspect of mental health. And on the whole, I'm very passionate about mental health because I feel that we are not taking it seriously here in the Bahamas. And I'm also a general practitioner. I have my own private practice where we specialize in both mental and medical health, and the name of my practice is Emmanuel Medical Center.
Okay, thank you so much, Dr. Knowles. Dr. Paul Scavala, who is a minister of the gospel. Dr. Scavala?
Yes, good afternoon, everyone. Good to be here with you. Former health director of the Bahamas Conference, and always interested in health and encouraging it and building people's lives, both physically and spiritually, for God's kingdom.
Thank you so much, Dr. Scavala. Dr. Yashika Seymour, who is a pediatrician.
Happy Sabbath, everyone. I am Dr. Yashika Seymour. I'm a pediatrician, which means I specialize in children. I also have a subspecialty in pediatric critical care. So anytime a child is extremely sick, requiring ICU level care, that will be me. Happy Sabbath, and I am happy to be here to answer any questions.
Okay, thank you, Dr. Seymour. And Dr. Vanessa Miller, who is a gynecologist.
Vanessa Miller. Originally, I worked as a computer scientist and then went on to medicine. I am a practicing obstetrician gynecologist in the state of Mississippi, and just very thankful to be here for the opportunity to talk. My passion is fitness and wellness. And I love to talk to people about what natural things you can do to prevent illness and to improve health. great to be here. Thank you.
Thank you so much for being here with us, Dr. Miller. So at this time, I invite persons who might have questions that they need answered. They can place them in the chat and we will read them for our panelists. At this time, I would like the readers to go ahead because we did have some persons who sent questions in prior to the program this evening, and so we will start with those questions.
Okay, first question goes to Dr. Miller, Vanessa Miller. How can women treat chronic recurring UTIs, urinary tract infections? How can they treat them? Dr. Vanessa?
Yes, I'm having some technical difficulties trying to connect with my laptop, so I'm on my phone right now. So how do women treat chronic recurrent urinary tract infections? The first thing I want to say is to prevent recurrent urinary tract infections, one of the first things that you need to do is to make sure that you're drinking sufficient water, and make sure also that you're not spending a lot of time holding your urine. So a lot of teachers get into this trap of holding their urine when they need to empty the bladder. So those two things will help to prevent recurrent urinary tract infections. But if you have multiple urinary tract infections, you probably need to be seen by a gynecologist or a urologist or a medical physician to find out why it is that you're having these recurrent infections. There may be some problem in the bladder, in the ureter, in the kidneys that can promote recurrent urinary tract infections. So first of all, you need to find out what is the cause and then get that cause taken care of.
I'd like to mention something as a urologist. This problem is a very perplexing problem to many urologists. It is a problem that is not always easily solved. There are some things that a woman should be aware of that may help her in preventing this problem. Number one, I recommend that no female of any age should ever use a bubble bath. The chemicals on the bubbles easily get into the vaginal area and cause infections, including urinary tract infections. So keep away from bubble baths. A woman should always also be mindful of the way she wipes when using the toilet. Pelvic toiletry, we call it, is very important in females. A woman should wipe properly. Very, very important. In some females, it even makes a difference as to what kind of underwear she uses. Some women contract bacteria from her underclothes. This is a problem that most women are not aware of, but very, very important. It is also important to be mindful of what you eat and drink. There are some things that are irritating to the urinary tract, which can eventually lead into a urinary infection. Yes, just 2 days ago, I saw a lady who had a problem because of what she is drinking. I recommend, highly recommend, that a woman keep away from drinking anything with caffeine in it. Caffeine is an irritant. It irritates the urinary tract and can lead to urinary infections.
This question goes out to Dr. Knowles. What are some physical indicators that mental health is affecting someone?
I can't see what it is.
All right, good afternoon. I'm so sorry. Can you repeat that again?
What are some physical or notable indicators that mental health is affecting someone?
Okay, great. All right, thank you so much for that question. Very, very excellent question. So I want to say that before I answer that question, with mental health affects the way you think, which affects the way you feel, and which affects the way you act. And in fact, mental health, not only just the way you think affects the way you feel, that affects the way you act, but mental health affects each of those areas. And so it's important that you are aware of what is happening to you as an individual, and also certainly with those who are around you, your loved ones, your colleagues, your co-workers, friends, so on and so forth. And I'm going to start off with men. What I'm finding for men who I encounter, a lot of men I'm finding are showing aggression and anger. And when I go ahead and I meet with them individually on an individual basis, and I do the screens on them, these men are severely depressed. All right, hear me today, Bahamas. That's a very, very important point because we have a serious, men are high risk in this country for suicide. And if you are aware of what's been happening in the news, basically last 3 months, and even dealing with the COVID-19 pandemic, we really need to make this a priority. And so for men, all of a sudden you're noticing on even your teenage boys, if they're starting to show signs of aggression and anger that you're not accustomed to seeing, something is going on. It could be depression, it could be substance use disorder, or it could be just, for chronic stress of living in this pandemic and everything that's associated with it financially. Certainly other physical symptoms that you may have, not sleeping is a very, very glaring sign. That's a big red flag. If someone is not sleeping, and that's continued to perpetuate day after day for 3, 4, 5, so that person is going to ultimately crash. They're going to hear things. They're going to lose touch with reality. All right, so not sleeping, and we as adults should be getting at least 8 hours of sleep each night. In terms of anxiety, and I'll just hit on the main mental health issues that I see. Anxiety, persons start to have shortness of breath. They may have chest pains. They may start to have a feeling that the world around them is going to collapse. And so if you are in touch with your bodies and you're recognizing that something doesn't feel right, that is definitely time where you need to see your general practitioner, your family medicine doctor, or talk to someone, whoever, depending on the situation. And why I am so very passionate, particularly about men, because we as men have been conditioned to not talk about our feelings. We got to suck it up and just go out there and do whatever needs to be done. And that is so wrong. We're training our young boys how to live like that. And as a result of that, we are losing touch with our feelings that God has placed within us. It's nothing wrong with feeling sad. There's nothing wrong with feeling depressed. It's nothing wrong with having feelings. And if once a guy gets to that point where he just basically is numb to what he's feeling, that is going to cause major problems. And I'm sad to say it, it can possibly lead to that man taking suicide. So those would be what I'm seeing in terms of the realm of what I work in mental health. Some of the physical symptoms that says that this could be a mental health issue. And in any event, get help and get help fast.
All right, our next question goes to Dr. Seymour. How can a 2-year-old acquire gonorrhea with hymen and rectum intact? How can a 2-year-old acquire gonorrhea with hymen and rectum intact? Dr. Seymour. Dr. Seymour, your mic is muted.
Thank you. Okay, I was saying that this is actually it's a very interesting question. What I want to start off by saying that when we think about gonorrhea, gonorrhea is actually considered a sexually transmitted infection. And so it's very important for everyone to realize, especially people with children and people that may see children or examine children, is that it is possible for there to be sexual abuse and still have your hymen or your rectum intact. So what I get from the question is the person is assuming that, okay, because everything is intact, that there may not be any exposure or any abuse to be considered. But I just want to clarify that the hymen and the rectum being intact does not mean that there is not abuse. So, like I said, it is considered a sexually transmitted infection. And so if a child has truly tested positive for gonorrhea now, truly tested, meaning not you're just looking and assuming that that's what it is, or you smell it and assume that that's what it is, I do feel as if that child needs to be seen by a pediatrician urgently. and evaluations and investigations need to be carried out. So I didn't quite answer the question, but I do want to put a lot of emphasis on the fact that hymen and rectums being intact means nothing when it comes to child abuse.
Okay, this question goes to Pastor Paul, and I guess Dr. Knowles can also pick up on it. How can one deal with the overwhelming grief that is occurring in our Bahamas today, especially for someone who has lost 3 members of their family in 3 weeks?
Certainly, that is challenging. And, you know, there are different defined stages of grief that people go through. And of course, you're having an intense situation here where people probably don't even have time to consider all that's going on in their lives. Of course, somebody to listen, somebody to just be present, who is trusted, to put a listening ear to what is happening. And depending on the level of grief and how it is protracted, some extended counseling and coaching might need to be carried on in evaluation from a professional. And so those who are involved and connected need to be aware of the fact that everybody needs to grieve, is designed to grieve, and being patient with individuals is important, particularly through the gift of listening. Doc might want to add additionally to this, but from a fundamental point of view, we need to identify it, recognize it, and be there for a person who might be going through the multiple cases of loss. And to the extent that they value what they have lost will determine the level of grief that the persons might be going through.
Hi, good afternoon again. Before I start, I want to thank you, Pastor Scavella, for back in 2010, you remember my brother passed away. You may or may not remember. And then 8 months later, my father passed away. And so I remember you were there for me during that time, referred to you by Dr. Feinson, who was my advisor. And so I appreciate the time that you counseled me during the time that I was grieving. And so I would speak not only professionally, but also from personal experience about grief. And the first point I want to make is that I know generally we tend to refer to grieving as the loss of a family member or a loved one. That is certainly true. But you can experience grief from losing your job, losing your home, losing a pet, losing an addiction that you were so accustomed to having. And so when we talk about grief, it involves losing anything that is valuable and that we found to be substantial in our lives. And so for tips for grieving, for the griever, the person that is going through, the first thing I would say, in addition to what Pastor Scavella said, is to get and accept the support that is available to you. And what do I mean by that? It's important that you turn to someone you trust, who you can really share what you are going through and what you're experiencing. Also draw comfort in your faith in God, especially for those of us who are Christians and believers. And if necessary, like I did at the time, even though he was not my pastor, I was glad to have had Pastor Scavella to be able to give me the emotional and spiritual support that I needed at that time, because nothing was making sense to me. Losing my brother, losing my father, and I even lost my stepmother at February, which had been about 2 months after my brother had passed. So 2011 was a really terrible year for me, but by God's grace, I made it. I think it's also important to understand when grief becomes a problem in the whole context of mental health. If a person is still grieving and has not moved on to some degree from the loss of their relative or whatever, after a period of 12 months, that becomes concerning. And that is something we call complicated grief disorder or complex grief disorder. Complex grief disorder. And so remember that time frame. Yes, you know, after losing something or a loved one, you're going to grieve, you're going to have memories, you know, basically go into, you know, still have that missing that person. But it becomes a problem when you can't move on, you can't function, you can't perform your duties as a mother or a father, or you can't perform at work, or you're not eating, or you're having periods of depression. And we look at about that time frame of 12 months. And so you may be dealing with complicated grief. And it is important that you get that person help right away. And it may not be very clear at the time whether that person is dealing with complicated grief versus major depressive disorder. But the fact of the matter is you get them to a physician, you get them to somebody in mental health, and we can go ahead and do the proper diagnosis and screening and get that person help that they need.
Thank you, Dr. Knowles. Mrs. Smith, what types of food should you consume to ensure your body is getting the proper nutrients for physical and mental well-being?
Okay, that's a very good question. Okay, so in order to get the amount of energy and nutrients that your body actually needs, you have to make healthy food choices, and that is choosing food from the various food groups. So we have fruits, vegetables, we have nuts and seeds, peas and beans, and our whole grains. Okay, and we like to use a plate that is more practical for us to follow and really to understand. So we want half of your plate to be vegetables, and that's the non-starchy vegetables. Your cabbage, carrots, broccoli, onions, cucumbers, vegetables like those, and then a quarter of it being your whole grains, particularly your starch foods, sweet potatoes, brown rice, cassavas, potatoes, foods like that. And then the other quarter of your plate now being your protein foods. And of course, we want you to choose more plant-based protein as opposed to animal protein, because a plant-based diet, of course, that was our original diet, and God made us and he gave us that diet, so he knows what's best for us. And even modern research is showing that, hey, a plant-based diet is the best one for us to be on. Okay, so we also have our fruits. We want you to have at least 2 servings of fruits every day. Of course, it's drinking sufficient water. So drink enough until your urine is consistently clear or pale color or straw color, we like to call it also. And it's also abstaining or eating less of sugar sweetened foods, the junk foods, the fast foods. Try to eat as less of those as possible. And of course, with healthy eating comes physical activity, and of course, those other eight doctors, natural doctors, but we want you to make sure that you eat in balance, all right? And it's making healthy food choices, eating real foods, all right? Eating foods as much as possible as nature created it. We want to stay away from refined foods, especially the oils and the greens. Those ones actually cause us to get sick more easily and more often. So we want to eat real food.
If I could just chime in there, this is Dr. Smith, I'm not sure, dietitian.
Miss Smith.
Miss Smith, all right, yes, you are absolutely right, if I can just say that. The food we eat, our diet in this country is, I hate to say it, pretty much killing us, both physically and mentally. The diet is so important that what you eat can even cause you to become depressed. You're eating that greasy food or that bamboo shack, I shouldn't call names, but that fried chicken and whatever, that is not nutritious. You're eating that day in and day out. Not only are you gonna pack on the weight, the pounds, and cause yourself to develop cardiovascular disease, but it affects your mood, your mentally. You feel luggy, you feel tired, you don't have any energy. And so absolutely the science is clear, a plant-based diet is the best thing for us. It gives us life, nutrition, it helps improve our mood, it helps us in terms of how we sleep and how we perform, the energy levels. I can't begin to even say how important that is. We have so many people walking around with dangerously high blood pressures. I mean, they just come to get a physical or maybe to get a health certificate, and we do check their pressures. Their blood pressures are in the 200s, and that bottom number is like 120, 130, 140, feeling no symptoms whatsoever. That's a walking time bomb. And if you are going to make any major change to your lifestyle, other than the exercise, the diet has to be important. Positive thinking is another area, but the diet is crucial. Until we change our diet in this country, we're really gonna have serious mental and medical issues.
Okay. Our next question goes to Dr. Evans, and it reads, if a boy is 7 years old and his foreskin is not able to be pulled back, should he be circumcised?
That is a condition known as phimosis, the tightening of the foreskin of the penis. In a 7-year-old, that could be an indication for circumcision. The circumcision would solve the problem. I want to mention at this point that this condition exists in older men as well, adults. In an adult, this condition, the phimosis, is diabetes until proven otherwise. Oftentimes, men come to me with this problem only to discover that they are diabetics, and that is what is causing the problem. It is unusual to have this happen in a child as a cause of diabetes, though it is possible. But in a 7-year-old, this is an indication for circumcision.
Thank you.
All right, our next question, sorry about that. Thanks, Dr. Evans, for your answer. This is like almost a 3-part question, and I can direct the question to the Dr. Smith, and anyone else who want to actually take a look at it. Is detoxing a good way to alkaline the body? And what do you recommend as an all-natural way to rid the body of excess disease-promoting waste? And then can detoxing lead to a healthy weight loss result?
Okay, so very good questions again. So what I just described about having a balanced diet, once you consume sufficient fiber particularly, and different fruits and vegetables, and they're loaded with lots of antioxidants, phytochemicals, all of those things that really help to keep the body healthy and clean. Okay, so you don't necessarily have to go and get any other kind of detoxing substances, I want to call them. You can actually use your food to clean your body, and that's actually the best thing to use. And of course, water, we like to downplay water a lot of times. Water goes a long way in helping to keep our bodies clean. Okay, and in terms of alkalizing your body as well, fruits and vegetables, they help to alkalize your body, so you don't have to worry about using other substances per se. Now, only in cases where, let's say, a person may be severely overweight, they may have a lot of risk factors, or even the factors there for having different chronic illnesses, that we may suggest using certain detox substances. And of course, it will be more of the natural nature, those of natural nature like herbs and stuff like that, rather than those other harsh chemicals that people may use to detox. But all in all, we want to use our food to keep our bodies clean, food and water. And also this would also help us to lose weight and helps the blood pressure to come down, the sugar to stabilize, all of those different chronic illnesses, the cholesterol, the heart disease. It will help to actually improve all of those conditions.
Thank you, Mrs. Smith. This question is for Dr. Miller. Should a parent be concerned if a 9-year-old starts menstruating?
Is she in? I am not certain she's in, because she did say she was having issues. So you could throw that question out to anybody. You can go ahead, Dr. Evans. You can start, and then also then we can take Dr. Seymour. She wants to take that.
Yes, I was actually going to comment. So when someone thinks about menstruation and whether or not it's occurring early, we call it premature puberty. And so it kind of depends on everything else that's going on with the child. I have to say that there are some children who go through normal development and can see their menses as early as 9 years. It is seen, unfortunately, more in Black females than it is in white. But the other thing, though, is what's more important is whether or not the child, before starting their menses, started to have their secondary sexual characteristics. So the body odor, the body hair, development of the breasts, whether or not there was pubic hair. So it's a question that it needs to be answered with all of the necessary information. So it can be normal for a 9-year-old to start seeing their menses and nothing to worry about. However, if it's something that happened and it wasn't in sequence where you had your secondary sexual characteristics, or I should say your primary and then your secondary sexual characteristics, then it actually is something that you should worry about. Hope that helps.
All right. Thank you, Dr. Seymour. Our next question, I think it goes again to Dr. Evans. I had my gallbladder removed some time ago. Can you elaborate on the side effects of its removal?
This is a question that is best answered by a general surgeon. However, I'll fall back on my younger years in surgery and doing general surgery. Removing the gallbladder usually is done because of either inflammation of the gallbladder called cholecystitis or gallstones causing problems, and it can cause very serious problems, or it may be due to some other disease of the gallbladder. Removing the gallbladder is not life-threatening. In fact, many individuals live a normal life without a gallbladder. The gallbladder, however, does serve a useful purpose when it comes to the digestion of fats in the diet. If a person has the gallbladder removed for whatever reason, the surgeon would advise that patient as to how to go about eating a diet that would not be injurious to the patient. That is, living without the gallbladder. Now, I am not an expert in that aspect of surgery because I no longer do general surgery. In fact, it's been 40 years since I've done it. So I would suggest if there is any further question concerning this, a general surgeon should be the person to talk to for precise advice.
Okay, next question. Thanks, Doc. Nobody else wanted to talk about that, right? Okay, so we'll go on to the next question. I'm going to join two questions together because I think Dr. Smith should be able to take care of this as well as other individuals. Can a person transition off their hypertension medication without being monitored by a doctor with a lifestyle change in diet and exercise? And then also, I want you to add, because you're dealing with food, can you suggest ways that a vegan can get vitamin B12?
Okay, so a person who is trying to transition from, it seems that they're trying to manage high blood pressure by lifestyle methods alone. All right, so if you're seeing a doctor before for managing high blood pressure and you're on medication, of course you need to be monitored, okay? Don't ever go without your doctor's advice. Let him know that, hey, I'm trying some natural, some lifestyle changes, and I would like to eventually be off the medication. So work with your doctor, just don't work by yourself. Okay, the other question was about B12.
Yes.
Okay, so I think they were asking different ways to get B12.
Yes,
okay,
from a vegan diet.
Yeah, I'm a vegan, and how do I get vitamin B12 in my diet? Most people will actually take supplements. I'm assuming that this is the situation, but they want to actually be able to get vitamin B12 in their diet. How can they?
Okay, so B12 can also, you can get it from fortified foods, especially like whole grains, cereals. You can get B12 from yeast flakes, something that, that is normally used by vegans. Also, there's a substance called liquid aminos. There are also some B vitamins in there. And of course, as Sister Claire mentioned, you can use supplements to get your B12.
Thank you, Shandira. Other questions for you. You mentioned earlier when formulating a proper diet that person should get real food. Question would like to know what is real food, and also you can probably answer this as well. How can you get rid of constipation quickly at home?
Okay, so real food will be those foods that were not processed or very lightly processed. So let's say, for example, I know mashed potato is a common food here in the Bahamas a lot of times. So rather than using a box mashed potato, you can use your natural potatoes and boil them, cook them, and make your own mashed potato. It's eating food in its whole form, like eating a dilly rather than drinking dilly juice, or let's say eating an apple rather than drinking apple juice. It's using whole grains rather than white processed foods. It's using unrefined oils rather than using refined oils. So we want to use food as nature provided them as much as possible. Okay, and the other question is about getting rid of constipation. So there are 3 things: drinking sufficient water, eating sufficient fiber, and remember that fiber is only found in plant foods, and also exercise. All right, exercise helps to keep things moving. So we want to make sure that we exercise on a regular basis, and that they will normally help to prevent constipation. And of course, I just want to speak more to fiber. Okay, a lot of, especially our Bahamian diet, we don't get sufficient fiber. We eat the white rice, the meats, and plenty meats are that, and they have no fiber in them. So it's very easy to get constipated. And so we want to make sure that half of our meal is non-starchy vegetables. I can't emphasize that enough. Okay, we need to get more vegetables in our diet so that we can prevent such conditions as constipation.
Okay, thank you, Dr. Smith. Our next question: can a person transition off their hypertension medication without being monitored by a doctor with a lifestyle change in diet and exercise?
Okay, so we answered a question a little while ago. So you want to work with your doctor and helping you to achieve your blood pressure goals.
Okay, there's a question in the chat. What is the truth about COVID-19 vaccines? I know that can be a vague question, and just touch a little bit on it so the person who put it in there can be a little satisfied. Thank you.
Okay, I'll touch on it just a little bit. Since I do have some experience in having to deal with new vaccines. I recall some years ago that a new vaccine was introduced into the Bahamas, and a number of individuals took that vaccine. Was it safe? That's the question, was it safe? Here's what I'll say based upon my personal experience with some patients. I had the misfortune of having to hospitalize a number of individuals who had problems from the vaccine. Because of that, I am very, very skeptical about new vaccines or unproven vaccines. Now, there are vaccines that are good, safe, that have done a lot of good for humanity, but those vaccines have been proven over the course of time. In terms of a new vaccine, it should be proven, its safety record should be proven, and there should be no question of the good that it would do. So far as new vaccines are concerned, I'm skeptical.
Thank you, Dr. Evans. This question is for Dr. Scavella. What would be the easiest way to introduce someone to Jesus?
Depending on a person's upbringing, their worldview, we have to ascertain that first and give you. We have many biblical examples of how Jesus would have introduced his concepts to people, and in anything, we need to find out what is a person's thinking process. We don't want to offend people. We don't want to drive a wedge between them. We don't want to break down the bridges that will help us to share. Of course, by your fruits, people will know how you live, your lifestyle, and they would want to understand, why is it that you don't eat this? Why do you do this? Why do you go to church on Sabbath? Just by the way you live. And of course, undergirding all of that is the whole concept of love. All right. And then there's something that Jesus did, which we refer to incarnational evangelism. He entered into the experience of people. All right. Where they existed, what were their circumstances, and then he mingled with them, found out what their situation in life is, identified their needs, addressed those needs, secured their confidence, and then invited them to be saved. And so there is a process that we talk about as the 7 S imperatives of introducing Christ to persons, and that is that process. And so we want to engage people, befriend them, let them know that we care about them, and then share the principles through our living that reflect Christ's principles in our lives to them. And then we'll be able to win their confidence, and they will be willing to follow us. And we can say to them, follow us as we follow Jesus Christ. I hope that's beneficial.
Okay, thank you. Our next question is, my relative is coughing a lot lately. Some of the food she eats comes up when she coughs, as if the food is stuck in her throat. Why is this? And what is the best recommendation for her to treat and prevent this from happening? Any doctor can take that if you wish.
Well, my approach to a problem like this is pretty simple and straightforward. See a gastroenterologist. That is, go to the proper physician who has an expert knowledge in this part of the body and this kind of problem. See a gastroenterologist, have the condition properly diagnosed and treated.
Thank you, Dr. Evans. Our next question, anyone can answer with the knowledge. How can one get rid of fibroids? How can one get rid of fibroids?
I'm going to take a stab at it. I'm not sure exactly what that person is getting at. It sounds like they might be saying without undergoing surgery, because surgery is definitely the most common means of treating uterine fibroids. However, there are several non-invasive methods of treating fibroids. And then there are things that you can do naturally to reduce your risk of fibroids, reduce the bleeding from fibroids, and know that estrogen is the hormone that promotes the growth of the fibroid. So if you're a person who is nearing menopause, then you may not have to do anything at all about fibroids, and they will start shrinking once the estrogen levels decrease.
Thank you, Dr. Evans. Dr. Miller. Our next question, what can be done naturally to combat depressive moods, also panic attacks or anxiety? Dr. Knowles or Dr. Smith?
Yes, I'll take that one. Okay, so that's also a very good question. I appreciate the fact that not everyone wants to be on medication. And even for me as a physician, I don't just put people on medication for medication's sake. There really has to be a very strong indication for putting persons on antidepressants or what we call anxiolytics, anti-anxiety medication. And so obviously the first thing that I would recommend is that talk therapy, having that person sit down, let's talk about what's going on, what is making you depressed, what's making you anxious, and see if we can deal with those issues directly. Because ultimately you want to get to the root or the source of the problem. The next thing I do is I teach persons in the case of anxiety how to breathe. There's a technique in breathing that can help mitigate anxiety and even anger and to some degree depression. And so a lot of us don't know how to breathe properly. And so I spend some time training persons how to breathe. So if they're faced, for example, with an anxiety attack, the first thing you want to do is get your breathing on point. Of course, the other thing I recommend, my clinic, my practice is spiritual based, is I say you have to have that prayer life. Pray to God. You know, whatever problems you're going through, whatever issues you're going through, seek the prayer and the counsel from the creator, your source of the creator. And certainly by extension, you may want to speak with your pastor, have that conversation with him. And if all else fails, including putting dietary practice in place, as I alluded to earlier, the diet can affect your mood, it affects how your brain functions. Exercise is certainly something you want to get on with. And the recommendation, if we're talking medically based on science, is 150 minutes per week. All of us should be getting. And that can be done 50 minutes or 3 times a week, or 30 minutes, or 50 minutes, 3 times a week, or 5 times a week for 30 minutes, however you want to divide it up. But the exercise mitigates depression, it mitigates anxiety, it helps you feel better, it gives you positive outlook on life, it releases endorphins where you feel better, so on and so forth. And then if all else fails, and if we need to get medication on board, then for me, at least I can speak for me, I always start with the lowest dose, and I start with the safest medication. There's no shame in taking medication, but at the same time, I try to work with patients who want to use other practices or conservative measures before starting medication. So I hope that answers the question.
Okay, thank you, Dr. Knowles. Next question is, what can I do for hiccups? I've known persons personally who've had hiccups for a whole week. What can I do for hiccups? And what causes it? I think, I don't know if Dr. Miller can handle that, or Dr. Evans, or Dr. Knowles, or Dr. Seymour.
The fact that no one wants to attempt to answer means that it's not an easy question. Now, I know traditionally we'd simply put a piece of brown paper on a person's forehead. Now, whether that works or not, I don't know. Medically, there are medications that can be used that are often successful in treating hiccups. Now, we know that hiccups is related to spasms of the diaphragm in that is the layer of muscle between the abdomen and the chest. It can be triggered by a number of conditions, but it's not an easy thing to solve. Sometimes it is simply solved with time. After a period of time, it goes away. In some people, it is protracted and can literally last for weeks at a time, and it can be most annoying. But as I said, there are medications that can be used, and oftentimes very successfully.
Sorry, I just wanted to add, so like Dr. Evans said, yes, it is a sign of diaphragmatic irritation. When we see it in babies, there's absolutely nothing for us to worry about. But from the ICU side of me now, it actually does increase our venous return to the heart also. And so if somebody really, truly is having like hiccups that just won't go away, I would still recommend you go and be seen first. Let's make sure that there's nothing life-threatening going on. And then after that, it is truly just the tincture of time.
Thank you, Dr. Seymour. You may also be able to answer this question. How can I treat acne in a 10-year-old that is also going through puberty?
That word puberty, it's like the worst thing, especially for females, but so when it comes to acne related to puberty, you know, puberty is basically hormonal surges. So it's where you have a young child, male or female, and they now have increase in their sex hormones. And so because of that, it can actually cause a lot of side effects. The intent is basically for the development of those sexual characteristics like breast development, hair, everything like that. But you also do have the development of acne. When it comes to hormones, the best thing in the pediatric population is actually your diet. I know this is kind of like a cliche now because we're constantly saying your diet, your lifestyle changes, diet and exercise makes a difference, but it truly does. Because what you're trying to do is regulate the hormones and not cause further surges. And we know that certain foods are associated with increases in your hormones. With all of that said, what is recommended is cleaning agents, so particularly anything that has peroxide. There are a lot of over-the-counter medications that can be used, Clear One, Proactive, even hydrogen peroxide that you could kind of make at home. But I would say before all of that, just start with regulating hormones, and you regulate your hormones by paying attention to eating healthy foods as opposed to just having fast food, which most teenagers like. Also, sugar. Sugar really contributes a lot to the development of acne. So if you could just make those dietary changes and exercise, it'll make a big difference.
Okay. Our next question says, are there any indicators that a man may have issues with testosterone levels, and how can that be, how can his testosterone levels be boosted?
The testosterone level in men is important. That is what is known commonly as the male hormone. As the male ages, his testosterone level tends to decrease. Now, men typically do not undergo abrupt changes in these testosterone levels, as it happens with the hormones in females. Women go through menopause, which is sometimes obviously noted, or changes taking place in her body. Men don't go through these abrupt changes like women do. However, men do undergo changes, and these hormonal changes can affect a man's well-being. There may be changes in his mood, changes in his skin, changes in his muscles. Many changes can take place over a period of time. Many men come to me because they're having problems with erectile dysfunction. They're having problems with erectile dysfunction because, in some cases, because of a decrease in the male hormone. So how can we correct this? Typically, we used to give hormone tablets. We don't do that anymore because we now know that taking hormone tablets can cause problems with the liver. However, we can give hormone shots, injections, and we know that these are usually quite safe. Most men don't need those injections. However, in certain cases, they are beneficial and help a man tremendously.
Okay, thank you very much, Dr. Evans. This question, I guess, goes to Dr. Miller, and then I'm thinking Dr. Smith can actually chime in as well. What boosts iron and blood supply when one has fibroids? What I'm assuming that they're asking, what can boost the iron and the blood supply when they have fibroids?
Okay, so the underlying question is, you're having severe bleeding or heavy periods because of what you do to replenish the iron in your blood. And yeah, Shandir is a good person to add to this as well. But I ask my patients to get dark green leafy vegetables, spinach, turnip greens, collard greens, beet greens, increase their intake of foods like beets, carrots. That combination tends to increase the amount of iron that you're getting in your food. And when you're taking your iron, you may need an iron supplement, a pill. When you take that, take it with an orange or a piece of a grapefruit, because the vitamin C helps your body to absorb the iron better. So those are some of the ways that you can increase the iron in your system.
Okay, so just to add to that, you want to eat foods with a lot of iron in them. In addition to the green leafy vegetables, you also have your nuts, your seeds, your peas, as well as your beans that you can get iron from. And so, as Dr. Vanessa mentioned, a good combination will be spinach, beets, and molasses. You sort of make a smoothie out of that, and it's a really, really good iron booster. It's about a cup of spinach, I think it's 2 tablespoons of molasses and a small beet. You just blend those together in about a third to half cup of water. And you drink that, I guess, about 2 to 3 times a day. And it really helps to boost your iron levels. And for those women who really we really lose a lot of blood, you may have to use iron supplements in addition to the ones in your diet. And as she mentioned, especially for persons who are vegans or vegetarians, you want to use vitamin C, a food with vitamin C in your diet, especially when you're having those high iron foods. So let's say if you're eating peas and beans, or if you're eating some greens, you want to make sure to have some food with vitamin C in it so that you can, so the body can actually absorb the iron better.
Thank you, Mrs. Smith.
Sorry.
This one is for Dr. Scavella.
Okay, before you go on to the next question, could I just say something?
Oh, sure, go ahead.
To say was sometimes family members or doctors recommend that you take liver to increase your iron. I want to say to everyone, if they tell you that, find another doctor. They're best educated in nutrition and wellness. So anyway, so if somebody tells you to eat liver, the liver is detoxifying your body. So it concentrates the toxins in your system. So if you're eating the liver from another animal, you're getting a lot of the toxins that they've been trying to get rid of. Now, why would you want secondhand toxins in your system? All right, thanks.
Thank you again. Dr. Scavella, how can I cope with my supervisor who keeps telling lies on me?
Have mercy. You're in a challenging position. The question asks, how do you cope? There are a number of coping mechanisms people use to survive. Sometimes we act like the ostrich and put our heads in the sand, and because we bury our heads and we think, well, everything is going to be okay. There are others who cope by avoiding the circumstances as much as you possibly can. However, I think the best thing to do is to follow biblical counsel. And sometimes this is challenging because of the types of supervisors that we have, the power that they might have over the particular institution or job or wherever we're working. However, when we follow principles of the Bible, we can't lose. The Bible talks about if our brother offends us, or person, we should first of all try to talk with them, and then if there's no resolution, then we try to incorporate somebody else. And everybody in life has a supervisor or a boss, somebody else. Sometimes it's always good to document things as well. Sometimes that is avoided, all right? And if nothing else works, not if nothing else works, of course, in the midst of all of this, we want to talk to the Lord about this, all right? Because the Lord is able to see sometimes things that we can't see, and also is able to help to guide us in this whole process. Let's make sure that we ourselves are in a position of doing the right things. All right. Sometimes we complain about our supervisors when there might be some things that we're not doing. So we need to examine ourselves and make sure that the supervisor doesn't have anything on us that might be detrimental to our circumstances. All right. And then when we've done everything that we can, then we have to wait on the Lord. And he could possibly find a way of solving the situation. And when he does bring the solution, then we have to be ready to accept it.
Okay, thank you, Dr. Paul Scavala. This question, I think we can throw it to Dr. Knowles and then swing it on over to Dr. Seymour. Are there any medical or mental factors that contribute to the learning challenges we see in our school system today?
Okay, so that's it's a very broad question. I can certainly share from my aspect of being in mental health. The first thing I want to say, we here in the Bahamas have this notion that children, don't have feelings or they don't go through things, and we are so wrong about that. Children, a lot of kids, and when I say children, and even adolescents, I can use from primary school all the way up to age 21, they are bombarded with so much stuff, so much issues, so many issues. It's important that we as parents, we be in tune with our children, know what's going on with them, because they are at school. We're not with them at school. I mean, and here in Providence, we're doing the class now, and even that is stressful for our kids because it's so different from what they are accustomed to. So I want to say the first thing, it's very important that we be aware of what our children, how they are express themselves. If we see any change in a child's behavior, something is going on. And we as parents need to investigate that, whether they're not eating or whether they're having problems sleeping or whether they just look sad or something's going on. So most definitely, I would say that, the environment that a child is in can play a factor on their mental health and even physically, because a lot of the mental symptoms are manifested physically. And if I can be very bold and frank, a lot of stuff happens in our communities that we as a people turn a blind eye to. What am I saying? I'm talking specifically about incest and sexual molestation. And it's time for us really to talk about it and to get the help, not only for the children that are being impacted, but by the persons who are doing it, because it's a vicious cycle that's continuing. And I hate to say it again, a lot of these things are happening in our small communities on the family islands, and that is being manifested through children in terms of how they react and even physically. If I can also add again, as I've said so earlier, and Ms. Smith, I'm sure you'll back me up on this, our diet affects how we learn, the foods that we eat. We're eating foods that are not very nutritious. Children eat that and then they go into school. Well, they are going to feel a certain kind of way during school. They are going to be more tired. They're not going to be able to really function in terms of their attention span in classes if you're giving them sugar, white sugar, first thing, those sweet cereals for breakfast in the morning. And people hate me if I become Minister of Health, but I'm sorry, but I'm banning that white sugar because of the fact that it's like the cancer feeds off of it. It's contributing to cancer. It's making us sick. It's making us lethargic. That white sugar, really and truly, for me, is a poison. So I've given a roundabout kind of answer to that. And I don't know if our esteemed pediatrician can add anything, but from the mental health standpoint, understand that, don't think that children don't feel. Don't think that your teenage son and daughters, they don't have issues, because really and truly, they do. They're bombarded with a lot of the media, the drugs, the sexual promiscuity, even the clothing. And so compared to when I was a kid, looking now when my daughter was 14, I see a dramatic difference in what I went through compared to what she's going through. The whole cell phones and the technology that we have nowadays makes it very difficult. And so it's upon us as parents and guardians to have that conversation with your child, your teenage sons and daughters, know if there's a difference in how they are responding, just rest assured something is going on, and you should be the first person that he or she should feel comfortable to turning to for help.
Okay, thanks, Dr. Knowles. Just to add to that, so the question about whether or not there are medical and mental issues that can contribute to the challenges that we see in school, absolutely, absolutely. So I'm actually going to start though, like with the medical side, in the sense that there are clearly defined learning disabilities that are currently in our population. So these are things like dyslexia. So that's when a child may have a problem being able to interpret certain things. They mix up certain letters. And so it's an actual it's a medically diagnosed condition in which the child truly will have a learning disability. We hear a lot of talk about autism, which is a spectrum. And so sometimes you have situations where the child may have something like autism, which actually interferes with their learning. And so yes, there is situations in which your child can have something that needs to be diagnosed that is contributing to their learning. Even, for example, I'll tell you, my nephew, when he was very young, he wasn't doing as well in school and he needed glasses. Once he got his glasses, he became an A student. And so we do have to pay attention to the medical part. The other group of the medical illnesses that can contribute are children that have chronic medical illnesses. So these may include children that may have type 1 diabetes or children that may have sickle cell disease. Usually when a child has a chronic medical illness, sometimes they can actually feel as if, you know, something is wrong with them. They don't meet, you know, they don't come up to standards. They feel as if they are weird in some way. And so that can actually lead to depression. And then the depression can actually lead to challenges within their school. So absolutely, you have both medical, mental, you have them all interrelated. And the fact that you're asking this question, I think is really good because it's something that we need to be aware of. We need to be aware of it as physicians. We need to be aware of it as parents. We need to be aware of it as aunts, uncles, and not just assume that, oh, a child is doing poorly in school because he's dumb. There's no such thing as far as I'm concerned. So the child will need to be evaluated and helped as much as they can. Thank you.
Thank you, Dr. Seymour. Dr. Knowles, you may be able to respond to this. What degree of mental illness does a person, a grown adult, 45-year-old plus, who cries for everything being reprimanded at work or when he or she has to explain themselves, have? Is there help for that person?
Okay. Okay, I'm just trying to digest that question a little bit. So certainly if, I'm assuming the assumption is, I guess to an extent, if a person all of a sudden starts exhibiting this kind of behavior, I'll kind of interpret it like that. I guess the first thing, the most important thing is if you feel that that person is not acting normally for whatever reason, or you may not have a reason for it, that person gets help, certainly mental health in terms of a psychologist, a psychiatrist, their physician. If it is indeed that that person may have some, reason, for example, death of a loved one or losing or breaking a relationship, or something that's causing them to act that way, then we can go ahead and try to provide the talk therapy and the help that that person may need. Now, if it's some sort of a personality trait, there's no real treatment for that per se. What do I mean? For example, someone who's borderline personality, where they're always attention seeking and they're always, woe is me kind of, attitude every day. And if you say something to them, they take it the wrong way, so on and so forth. That's kind of hard to treat them. For that person, I mean, there has to be some talk therapy to a degree to help them understand that, you know what, don't take things so personally, that you may, want to look at life in a more positive light instead of putting the emphasis on you to the point where you are crying and where you are, just living this defeated mentality, so to speak, all right? And so it really depends, but the bottom line is, and that's why I say at the beginning of two things. One, we need to know our bodies, know who we are physically and mentally. If you feel that something is not right, then something is probably happening, you should get help for it. And then two, recognize, be our brothers and sisters keepers. If you know somebody who isn't acting right, then try to help them. Don't get on the phone and gossip about them or go telling someone else about them. Try to provide help for them. Point them in the right direction in order for them to get the help that they need. So I hope I answered that question. I try to answer it broadly depending on the scenario. But just generally, if someone is not acting right or acting in a very strange way, then that person, try to get that person help. And again, if it's personality tends to be formed, from the teenage childhood years. It may be a person who's introverted versus a person being more extroverted, or again, based on their environment where they may have been abused. And so they develop this kind of defeatist mentality where, somebody says something to them, they take it personally and so on and so forth. So you have to take into account the person's personality as well.
Okay, thank you, Dr. Knowles. Our next question, anyone, I guess, can answer with the background. How do you know if you have experienced menopause? If you are a person whose cycle is irregular. My best friend hasn't seen her period since August, and she is 48 years old with a history of fibroids.
Okay, so menopause, the definition for menopause is the absence of menstruation for a period of 12 months. But there are some signs and symptoms that go along with menopause apart from having menses. And that includes hot flashes, irritability, vaginal dryness. These are some of the other symptoms that you might experience that would lead you to know that you're either going through menopause or close to menopause. In addition, you can have a blood test done. You can have your estrogen level tested and follicle stimulating hormone tested, and those will give you a good sense of where you are.
Thank you.
Okay, there's nobody else taking that. Let's go on to the next question. How is it that someone who is diagnosed with ADHD can sit still and complete tasks when certain persons enter the room? Let's see. I guess the pediatrician got to take that one.
It's like a pediatrician's question. So the question is, how can someone who has ADHD sit still when someone enters the room, but others can't? That's what the question was?
I am not certain, but I'm assuming that they expect the child to actually misbehave or whatever, and they are not doing it, and all of a sudden they're still.
Right.
Sound like they scared of the person who entered the room.
Absolutely. So just so you know, when it comes to ADHD, there's two phases of it. It's the hyperactivity and the impulsivity. So it kind of depends on which one the child has more of. And you're absolutely correct. It's possible that the child could just be afraid of that particular person, and so they're able to control themselves. Just remember, with most of these illnesses, there are varying degrees. And then on top of that, you have some parents that are actually working with the child and helping them to control these impulses and this hyperactivity. So it's a vague question, but it all depends on the circumstances. If you're challenging the diagnosis, absolutely you're allowed to do that. And if you think that it may be a situation that your child may not have ADHD, then take the child and get a second opinion. It could be very well that the child does not have ADHD, but just gets overly excited with certain stimulus. So please, don't be afraid to get a second opinion.
If I may add to that, Dr. Seymour, you said it very beautifully. Just so for our audience to be aware, when it comes to mental health diagnoses, there's a criteria that we in mental health use, and that is something called the Diagnostic and Statistical Manual, the 5th edition. And I have a copy of it here that we use. So anywhere in the world in mental health, this is what we use. And so there's a criteria, as Dr. Seymour has said, that has to be met as it relates to the hyperactivity and or impulsivity. And I think with that diagnosis, it's important to mention that there is impairment in the case of a child in their academic performance, their social performance, and in the case of an adult, adults can be diagnosed with ADHD, occupational. And so there's a criteria that has to be met. And so when we make these diagnoses, it's based on the criteria, and then there is certain severities, mild, moderate, severe, certain ranges of it, degrees of it. And so all of that has to be taken into consideration. If again, and I agree with Dr. Seymour 1000%, if you suspect that the diagnosis may not be adding up, there's a lot of people Google, they go Googling and reading stuff, which is good. I encourage my patients to do that, but make sure it's the right information. That's my only thing. If you're not sure or comfortable with that diagnosis, get a second opinion. And in that way, at least you will have a better idea of what's really happening with your child or even with yourself as an adult.
Thank you so much, Dr. Knowles. This question can be put to Dr. Scavella. I am in my 40s. How can I cope with loneliness as a widow?
Well, that's a question that pops up quite regularly with people who have lost. First of all, when God created us, he created us for companionship. And if you have been in a marital relationship with somebody and there's a loss of a spouse, it is only natural for one to be able to be challenged. And then different people handle that challenge differently. As a young pastor, I didn't understand that. And I would have matured in my understanding of that, even with people who are, older, 50, 60, 70, and they have a loss. And understanding that loss and how to cope with it is important for us to understand. Children with parents who are older. Now, how do we cope with it? People use different ways to cope. Some people feel that they have to have another companion, another marriage, and that's fine and good as long as it meets the criteria of heaven. Other folk get involved in growing themselves in other ways that occupy their time. And talking about it is certainly the first step. Admitting that there is a challenge and that they need to get a solution to it. And as counselors and as coaches, we can help people to generate options in this regard, and see what the potential is for helping to minimize that loneliness and how do we deal with that. All right. And for different people, there are different time frames that this would take. All right. So we would counsel you to not discard the sense of loneliness and how you deal with that. There are different ways of coping with it. Some people travel, some people get another job, they increase their educational capacity, they deal with their grandchildren, they get more involved in church. There's so many different ways. All right, so let's talk about it, and let's come up with a plan for you.
Okay, thank you, Pastor Scavella. Our next question reads, after my brother changed his diet to become healthier, he noticed that whenever he would eat foods with a certain level of salt, the saltiness stays on his tongue for a while after he's eaten. What is the reason for this? Anyone can take that one.
I'm not sure I understand the question completely. However, I will say that when you do change your diet, your taste buds change. And things that you used to like, you don't like anymore. Things that were sweet taste like they're super sweet. Things that were salty taste like they're super salty because your diet, I mean, your taste buds have changed as a result of you changing your diet. So when you move to a healthier diet, then the unhealthy stuff is less appealing to you.
Right. The taste buds actually down regulate, and he probably now just has less taste buds for that. And so they get saturated very quickly. And that perception of being saturated very quickly is kind of overwhelming, and it seems to last longer.
Okay, next question. Thanks, doctors, for your answer. Next question, I think, goes with Dr. Knowles, An adult is being or seem unable to understand or reason, is forward or mullish. Is that a form of mental issue?
Okay, forward or mullish? Forward, okay. I guess when we say forward, what, getting into things that don't concern them, or?
I am assuming.
Okay. All right, so again, when we talk about mental health, with mental health, generally speaking, it's important that we're making a comparison. Is there a change in this person's behavior? Is there a change from what they used to be? We don't want to just start categorizing people, without knowing certainly the facts, and then without for certain, I guess, having the conversation with that individual to kind of get an idea of what's going on. It's important to be able to point that person in the right direction to get help. When I say get help, if you feel that, let's say in the work environment, this person is acting a particular way that, that you suspect is not normal, that is deviant from the way that they should be acting, or from even societal norms, then, I would say that, and this is one reason why I tend to say that I would like for every institution, as best as possible, to have mental health as a priority. Whereas if your employees are not acting right, if you recognize someone is not performing well, there's a way to refer them to get the help, to find out what exactly is going on. And again, I go back to say that some persons, if that's their personality, you can't really treat a person's personality, but you can have that conversation with them, a mental health specialist, to help them to see why their behavior may not be the best behavior that they should be exhibiting, and to help them to see why it's important for them to make adjustments. But I don't like to just lump certain things as being a mental health issue, because it may not necessarily be that. And the best way to obviously find out is to have that dialogue with the individual. And again, when you're having that dialogue with the individual, it's important that we have the facts so that we can thereby be able to offer the proper help that he or she may need.
Thank you, Dr. Knowles. This one is for Dr. Miller. How long do you go through menopause?
Okay, as with most medical diagnoses, this really depends. It depends on the individual. There is a range, probably a minimum of 2 years, but I know people who have been experiencing the symptoms of menopause for 40 years. So it really depends. For instance, if there is someone who had a oophorectomy earlier in life, like in their 30s, and so they are deprived of estrogen for a long period of time, they tend to have a much longer symptomatic menopausal period. It also depends on your lifestyle and your diet. People who have a lot of soy in their diet, a lot of activity and exercise in their diet, tend to have fewer symptoms of menopause. So it really is not a question that we can give a particular answer to. It depends.
Okay, thank you, Dr. Miller. Our final question for tonight is, can you suggest ways to introduce the topic of vasectomy? Anyone can answer.
Yes, I think I understood what you asked. Was it ways of introducing the question of vasectomy?
Yes, sir.
Well, a vasectomy is a surgical procedure to interrupt a little tube called the vas deferens. This is a little tube that carries sperm from the testicle to the outside for the purpose of either getting a pregnancy or not. Now, a vasectomy is a minor surgical procedure that is commonly performed to prevent pregnancy. There are other indications for a vasectomy other than preventing pregnancy. I've done many vasectomies which had nothing to do with the pregnancy. The vasectomy can also be done in the case of chronic orchitis. That means long-term inflammation of the testicle. Bacteria or chemicals or whatever can travel down the vas deferens to the testicle and cause inflammation, infection, etc. in the testicles. In some cases where this is chronic or is a recurring problem, a vasectomy can be done to solve the problem.
I'm gonna also step in a little bit because I talk to my patients a lot about vasectomy, not on themselves, obviously, but on their partner. And for some reason, men are extremely, and the ones that I have had experience with anyway, are extremely reticent to undergo vasectomy because they feel that there may be side effects that affect their sexuality, presumably. And so it's a difficult thing to get the male partner to understand. And, you know, one of the things that I tell my patients is, you know, help them understand that you have borne the brunt of this pregnancy or these pregnancies for these 3 children that you guys have had together. And maybe if this is a reasonable person, you can have them at least have a consultation with a urologist to allay the fears that they might have or the anxieties that they may have towards what may be the adverse effects or after effects of having a vasectomy.
I think, Doctor, you've touched on a very, very important point. The question of side effects of a vasectomy. Now, this is a question that I always discuss with men who are going to have a vasectomy. And it's important for a man to know whether to expect side effects or not. Now, other than side effects that can occur with any surgery, such as bleeding, swelling, pain and discomfort, infection, etc., the vasectomy itself is a minor procedure, minor surgical procedure that should not cause any side effects. I always tell my patients before doing a vasectomy that yes, you can have side effects such as those I just mentioned. However, most men by far have no side effects whatsoever. For example, I do vasectomies in my office. It's a minor procedure. Men walk in, they have the vasectomy and walk out just like they walked in. And they should not have any side effects. If the vasectomy is properly done, there shouldn't be any other problems. That is not to say that some men won't have problems. There are some individuals who will have problems if you look at them for too long a period of time. So I tell men, don't expect any side effects. However, here is what could happen. You could have some swelling, which most men don't. I advise them what to do to avoid the swelling. Infection. Any surgical procedure can result in an infection. So I advise men what to do to avoid infections, etc., etc., etc.
Thank you so much. Thank you so much, Dr. Evans. Thank you so much to all our panelists. I'm sure that all of our guests, who we really appreciate coming, are more enlightened on how to better take care of themselves physically, emotionally, and also spiritually. So we want to say a special thank you again to all of our panelists and to all of the health leaders who were directing the questions. We also want to say thank you to Pastor Kenny DeVoe and Brother Leonardo Roll, who did the opening prayer, and from the president who did the greetings. At this time, we invite Pastor Paul Scavala to do a short Vespers. Thank you all so much for coming. Okay, Dr. Roll, thank you. Dr. Knoll, sorry, thank you so much. I know that you have to leave. We do appreciate your input. Thanks so much.
Yes, as we conclude this evening, the Apostle Paul in Romans chapter 12, verse 1 says, I beseech you, therefore, brethren, by the mercies of God, that you present your bodies a living sacrifice, wholly acceptable unto God, which is your reasonable service. Paul understood that it was important for us as Christians to make sacrifices in the same way that God foreshadowed sacrifices for our sins after sin came into this world by setting up a sacrificial system where people had to slay lambs and make sacrifices to atone for sins by faith, pointing to Jesus Christ, who would come and who was forecasted to come from the foundations of the world, and who did come and die on Calvary's cross for our sins. He had to lay his body as a sacrifice on the cross so that you and I might be able to live. And Paul says the story doesn't stop there, that he beseeches each of us, therefore, by God's mercies, to present our bodies living sacrifices, wholly acceptable unto God, which is not unreasonable for God to ask of us. A part of the sacrifices that we have to make is that we have to make decisions about our health. We have to sacrifice some things that we love that will cause us to damage our bodies. We have to sacrifice some things that we love that will cause us, if we embrace them, to damage our minds, our thinking, because God knows that what goes in will come out. Garbage in, garbage out. There are many things that we have to sacrifice in this world in order to live a successful Christian life and one that is wholesome. And so we are reminded that this is a reasonable request that God has made for us. There are so many things that our taste buds love, but they're not good for us. And God says, I'm not asking you to do anything that is unreasonable. I'm asking you to make a reasonable decision to do away with some salt, to do away with some sugar, to do away with things that are unholy for you. Oh, be careful, little eyes, what we watch, what we put into our minds. It's reasonable for you to put things that are in your mind that will help you to be healthy and mentally whole. And so as we have listened to this conversation and been engaged in this dialogue this afternoon, I ask you, what reasonably can you give up and sacrifice so that you might be a better person to reflect Christ in 2020 December? Christmas is coming up. Are you going to reasonably be able to not eat all of that food and eat the right kind of food while we celebrate the birth of Christ, who sacrificed for us so that we might be able to celebrate? How unreasonable is it for him to ask us to govern ourselves accordingly? Well, Paul says it is a reasonable request. And I reasonably would like to reason with you, to ask you to be reasonable in making reasonable decisions today and always.
Okay, Pastor Scavala, just before you do the closing prayer for us, I would be remiss if I didn't say a special thank you to you and the officers and members of the Centralville Church for facilitating this event for us, especially the media department. We do appreciate it. Thank you so much.
You're welcome.